Hello and welcome to BackWords. I'm Dr. Dan Francis. I am a chiropractor in Plymouth, Wisconsin. We have a little series that's going to happen over the next 13 weeks. And what we're trying to accomplish with this show BackWords is to expose you to a bunch of different alternative therapies and health ideas that will enable you and empower you to a better lifestyle and better health overall. We're all privy to the fact that healthcare costs are getting way out of control, and what we are trying to do is put you back in power of your own destination. Your body is an incredible, incredible organism, and really what we're going to do is we're going to touch on different factors that affect it in many different ways. Tonight, I'm going to explain about what I do so you have an understanding about chiropractic. I am not trying to promote me as a chiropractor. I'm going to talk about the chiropractic field, explain different philosophies about it. I'll show you a couple techniques in the second half. But really, more importantly to me, is this is the avenue in which I help people and many other chiropractors help people. I'd really love for you to look at some of these other shows coming up because we have great guests from acupuncturists to yoga folks, naturopaths. We're going to be looking at different dietary things you could do. We're going to show you core exercises. So there's just all kinds of great information that you can use and access, and it should drive more questions for you about your own health and your own well-being. And if you utilize those tools and you ask your physicians and your chiropractor and your massage therapist and your acupuncture about this or that, you should be able to get better health care for yourself and get well. And that's really what we're looking to do, because I got into the chiropractic field. I've been in this for about 20 years now, 21 years, 22 years. I've been in Plymouth for 21. And I got into it because I am passionate about healthcare and fitness. And I played Division III college football, like to do triathlons now. So I've always loved the health and wellness part of life. And one of the aspects that is core to that is your spine. And we've got a spine model here. It gets into the family. I have two sisters that are also chiropractors. They are also both acupuncturists, and one of them is a naturopath. Not in my area, one's in Ohio, one's in New York. But the human body is incredible, and chiropractic is a pretty neat field. It's been around for 100 years or so. And originally when chiropractic started, it actually started more as a restoration of nerve function to a lot of visceral organs. They treated a lot of organ-related items. And chiropractic now tends to lead towards the muscular and skeletal aspects of healthcare. But as we'll talk later, that integrates into overall wellness in many different factors. So when you look at chiropractic, chiro means hand, and to practice with the hands. So what I am allowed to use is my hands in different states. All you're allowed to do is the manipulation or adjustment, depending on what they want to call it. In Wisconsin, we're allowed to use different physical therapy modalities, such as ultrasound and electrical muscle stimulation. So there's some overlap between what I do and a physical therapist does. But I don't look at that as competition because I do a lot different, and they offer a lot of things that I do that I don't do. So I refer to physical therapists a lot. So there's a niche for everyone, and our niche tends to be the spine. Although we treat if it's a joint that I can move, you can pretty much treat it. And what we're looking at here is the human spine. I'll take it off here. From the side, you can see you've got a couple different curves. This is called the lordosis in the neck, or the cervical spine, or seventh cervical spine. The mid-back, the thoracic spine, is where the ribs attach. That's the thoracic cage, the thoracic vertebra. 12 of those, 24 ribs, one on each side. Then the low back, the 5 biggest vertebra, that is the lumbar spine. And then you have the sacrum and the coccyx, which the coccyx is the remnant tailbone. Those are both bones that are a fusion of 5 for the sacrum and 4 for the coccyx. They form the wedge in the pelvic basin. And then you have the pelvic bones, and you can see the femur attaching in to the acetabulum or the hip socket. So that's your basic spinal format. From the front, this should be straight. From the side, it should have those curves. It acts like a shock absorber. And many of the things that we treat are based on faulty posture. When you've got a bowling ball up here, the head, when someone's head is being held forward because you're at a desk job, you're studying, you're an accountant looking forward, you're a dentist or a hygienist looking forward, you're a mom making lunches, all this stuff. Now, that weight, you have to bear that with your neck muscles, and all the mechanics fall apart. So as chiropractors, what we do is we're really trained in school to go through and first diagnose, and that's an important thing, because first and foremost, when someone comes in, I need to make sure that they belong in my office and it's something that I can treat. Because if I can't treat it, it's my responsibility and the patient's best effort to get them out to somebody who is more proficient. For example, if someone has back pain, and this happened a month ago, guy had back pain, all kinds of difficulties. We adjusted him a couple times, no big deal. Took an x-ray, he wasn't getting better. He had a degenerated hip. I could have treated him till I was blue in the face. He wasn't going to get better. His problem was his hip issue. He needed a hip surgery. We sent him to a local orthopedist. He got the hip replacement. Guy's good as new. Okay, so that's important. I need to be able to diagnose and catch those things and get them to the right doctor. Once I decide that the patient is here, what we're really looking for, a lot of people dummy down chiropractic and they say, I've got a bone out of place. So now I am giving you how I practice. All chiropractors practice different. Everyone's going to get you better in their own different way. Okay, some people are going to respond to my method, some people won't, and they're going to respond to another type of chiropractic method. But I don't believe you get a bone out of place and I'm clunking it back in. What really tends to happen is that the motion segment or a vertebra and how it moves upon one, it's able to rotate, flex, extend, bend side to side, and all those combinations in between. When those motions get off balance, stuck, locked, however you want to call it, subluxated, there's all kinds of terms. When that happens, then the body mechanics fall apart. If this is stuck and not moving, it's going to cause muscle spasm. You can cause irritation to nerves. And there's all kinds of different causes and sources for it. But the net result is, if you don't fix that mechanics, the body can't work right. It's very much like the wheel of a car. If you hit a pothole and you knock your wheel out of alignment, you can drive for 10 miles, no big deal, no big side effect, right? But if you drive for 10,000, that tire is going to show a wear pattern. You can put a new tire on, that tire is going to show another wear pattern once it's been on long enough, until you balance how that moves. And chiropractic really is about movement. It's about trying to get the spine or the joints, depending on what people are coming into, trying to get those movement patterns corrected. And how we do that is primarily with our hands. Now, there are other tools that we use to help us, but there are a lot of different manipulation techniques with your hands. The method that I use is called diversified. It's sort of a grab bag of a bunch of different techniques that we use, and that works great. There are other techniques such as the activator. Okay, this is an activator. Now, I don't practice activator technique throughout my whole practice, but I have one here because I find it's very useful in certain circumstances. There are other chiropractors that use this with great success, and that's all they use. They don't actually manually manipulate with their hands. So there are different techniques, and certain people love this. If someone moves here from out of town and they loved their activator doc, well, I can provide this for them. Okay, but because if they had success, why change what was working for them? But it's a nice technique, and it definitely works in certain circumstances that I personally like to use it for. And I'll show you that in the second half after we take a break in a little bit. But there are a lot of different techniques that chiropractors can use. And our main goal, a lot of the different things that people come into us for are pinching of the nerves. So these upper nerves in the cervical spine, well, if you have these postural stresses over and over year after year, that can pressure on these nerves. These nerves out of the upper cervical spine go into the skull, so you could be getting headaches from them. It could be a whiplash. When you get a whiplash, the neck, like in a car accident, you get rear-ended, it goes back, which strains the ligaments in the front, and then the head whips forward, which tears the ligaments in the back. Well, those tissues need to be healed. And when I'm adjusting someone's vertebra, I'm not actually necessarily just adjusting, I'm not impacting just the bone, but I'm adjusting the tissue in between. So when I put a force into the soft tissue that connects these, that the spine doesn't show, those forces create the body to respond. And like in a car accident victim, we're talking about somebody who's got a tear and is going to develop a scar. If you develop that scar in the proper method and do the proper things for it, you can develop a healthier, stronger scar that leaves less residual to the person. And if you could do that, you've impacted their life. They can't just rely on you, though. Part of the chiropractic profession is I need to teach them exercises and different home things that they can do to help the function that I put back in there. Really, the people I love to treat the most are the people that take what I do and use it. And their lives get better from it. Their function gets better from it. I'd much rather someone say, I feel better. I'm not sitting on a couch anymore. I treated a gal who was on disability. She recently, get this, applied to get off of disability because she was feeling so good. It's one of my top 5 all-time favorite patients. Someone getting off of disability because they got better. You don't hear that too often. And so we're trying to adjust the vertebra and get normal motion and mechanics restored. And in doing that, we're impacting muscles, we're impacting ligaments, we're impacting disc tissue. We treat a lot of people, chiropractic treats a lot of people who have disc issues. And when the disc gets a bulge or gets inflamed, all kinds of different things can go on in there. You can pinch that nerve. And if you get a pinched nerve, it could be local back pain, that excruciating kind that bends you over. It could lead to, if in the low back, it could lead to sciatic, where it goes down the leg and the arm. It could lead to numbness. So even in the mid-back, it can lead to dysfunction of organs. And if the stomach comes from innervation within this area of the thoracic spine, if that's being pinched, a lot of people will experience a higher incidence of reflux. So they'll notice that, boy, my reflux is a little better after I was adjusted. I'm not curing it, but I'm affecting the nerve flow to it so you can improve it a bit and improve the function of the body in that manner. And the spine protects the nervous system, so it's vital to make sure that's good and clear. And that's our main job as a chiropractor, to provide good flow and function into the nervous system. So we're going to take a break. When we come back, we're going to go into one of my treatment rooms. And we're going to show you some of the different techniques that chiropractic uses to help people. We're talking back, and today we're talking neck posture. And when you look at the spine from the side, you see we have a couple curves in here. Well, the spine has the skull sitting on top of it. And if your spine goes forward, meaning bad posture, that curve falls forward. Now all the weight has to be borne by the muscles, and that's no good. We want that curve back in there. And to do that, what I suggest is people lay down on their back with a towel rolled up under their neck, or we use foam wedges sometimes, and that drops the head back, creating a nice stretch in the neck, and really is the key to good spinal posture. And one of the things you want to keep is good spinal posture, because if the head goes forward, the whole chain of command gets lost. And from there, it's real important. If you lose that, it's no good. So we'll be right back. Welcome back. Dan Francis here, and we're in one of my treatment rooms now. And what we're going to do is, I've got my son Paul as our guinea pig today. I'm going to show you a couple of different adjustments that we do, and just walk you through them. And Paul's a junior at Plymouth High School, and he's a track athlete and a cross-country runner, so he's got a lot of sinewy, strong muscles. And we'll show you a couple of the different adjustment techniques I use. I'm going to show you a couple different soft tissue techniques. There are a lot of different, not just adjustments. The adjustment is when you're taking the vertebra and you're moving the vertebra, okay? Now, when that happens, you're affecting soft tissue. Well, if there's a lot of spasm in muscles, okay, it makes the adjustment easier if you've done some soft tissue work. At least that's how we practice. So a lot of times when we have a patient, we'll work on their muscles. We're going to work on the muscles, and like Paul has a spot here. It's called a trigger point. It's a local area of spasm, and you can see him flinch a little bit when I hit that spot. That spot is an area that he needs to work out as far as stretching. And then if you work it before you adjust it, what happens is you're going to get better movement in the vertebra. And the more movement we get in the vertebra, the more restoration he's going to get in his function, and the faster he's going to be on the track, and which is good. So he's lying in what is called the prone position, and chiropractic tables have all kinds of releases. This is a table that is built like a Sherman tank. It's actually 30 years old. It was here when this practice was built. It works like a charm yet, though. And so when a patient's prone, I'm going to look at the cervical spine. I work the muscles in this position, but I don't too often adjust them in that position. But I can adjust their upper back in this position, and I can also get the neck cervical junction. And a lot of times with that, you'll have them tilt, and like I have Paul just breathe out a bit, and boom, he adjusted. It's just a quick thrust, the adjustment. When you're using the hands, the spinal adjustment is really just an impulse. It's just an impulse. A lot of people are a little nervous about it. They don't know what the cracking noise is. That cracking noise is just actually air popping in the joint. As you gap that joint, I'll show you on this vertebra here. As you gap that joint and create a vacuum, it makes nitrogen gas come out of that solution, and you hear that pop noise. That in itself doesn't necessarily do anything, but what it does do is it tells me that I move the vertebra a certain distance, which means I put force through a spine that's going to help the spine get stronger and the scar tissue get more flexible. Okay, so that helps restore function. So this was actually, I used his head a little bit, but that was actually an adjustment for his upper back. It released nice and well. And now in the mid-back, there's a couple different techniques we use. The one, I like to drop this centerpiece. It gives the patient a little more comfort. And we'll just cross our hands. And you just impulse in, and he moved nice and simple. Now, Paul's thick and got a lot of muscle. So you're not going to hear a lot of times the audible release in there, but you felt the popping, right, Paul?
Yeah.
Yeah, so you feel that popping noise. He moved pretty good. And a lot of times if I don't get that vertebra to pop, I'll move the position, or to release, whatever you want to call. I'll move the person into a different style, so a different position, so I can get that movement that I want on that visit. There are times where you can only get so much movement, and you have to take what the body gives you, especially like in a traumatic incident. If someone was in an accident, you can't force the adjustment, otherwise the patient is going to get sore. And that's real important. The last thing you want to do is create soreness in muscles that are already not at their peak. Okay, so you can see it's not a big violent move. Now, if you lie on your side for me, Paul, facing me, I'm going to lock this. Actually, you know what? Go straight down. There's this table, and this is one of the reasons why I came over here, has a what's called a Thompson drop. This piece drops. And so a lot of chiropractors will use this. This cocks up, and for the low back, they'll take their contacts, low back or pelvis, and they'll thrust through that. And that's relatively comfortable for the patient. It's really low impact. there's no rotation. So if someone's real sensitive to rotation or can't take the adjustment I'm going to show you in a minute, this is a real nice technique. A lot of chiropractors actually use it because it's easier on the chiropractor, and you'll see what I mean when I look at the next technique. But this Thompson drop is a nice technique for adjusting purely pelvic issues in the lumbosacral area of the spine, and it's very freeing and gentle. We use it a lot on pregnant women. You can drop this pregnancy release so their belly can fit in there all the way up to the day before they deliver. I've treated pregnant women in that kind of situation, and this technique works real good with them without putting any force whatsoever through the baby. So now we'll show you. You can lie facing me. This is called a side lying position for the low back. And when I adjusted the mid back from back to front, well, the reason you wouldn't want to do the back that way is, number one, the vertebra joints are shaped different. So the way to position them to get them to lock out is just different. But the other issue is, if someone's lying down on their belly and I'm thrusting here back to front, it's like a sucker punch to the gut. It doesn't feel good on your organs. Where in your mid back, you've got your rib cage protecting it. So this side lying technique, it's more cumbersome, but it's actually way more gentle and way more effective. And what we do here is we have the patient scoot over. And believe it or not, I've been practicing 22 years total and yet to drop a patient. So I just hold them right here and let this leg drop. And I adjust the vertebra just like so. So you can see it's pretty physical. Paul's lean. I have patients that are 300-400 pounds, literally. We live in an area that has some pretty good sized folks, so I try to stay healthy and in shape because I need to. It's a pretty physical job. But this adjustment, what I'm doing, it may look the same every time I do it, but it's not, because when I'm working on a patient's muscle, what I'm doing is I'm actually palpating their joint and I'm finding out where that joint is stuck and in which range. And when I find that, then if I'm standing here, I might adjust this way on this vertebra. The other side, I may adjust in a different line, and that gives the correction that vertebra needs to remove the pressure off the nerve. So it goes a long way in helping the patient get the flexibility and the health and the pain relief and function restoration that they need. So why don't you lie on your back, buddy? Now, the neck is the part that people are probably the queasiest on. And when you watch it done, if you've watched too many Chuck Norris movies, it doesn't look the coolest. But it's actually a really gentle thing. And when we work on the cervical spine, we try to work on those muscles a little bit and loosen them up. And there's a thing called the lockout in chiropractic. That is where you take the joint to where it's positioned near its end range. That's where we adjust it. And we take Paul to his lockout, and that's it. You can see it's not this massive thrust. It's just boom, quick, easy, and painless. And it moves nice and easy like that. You can see when positioned right, it's really just sort of a flick of the wrist. You might have heard that one. That one was a little louder. That's just the air popping in his neck. And literally with Paul, I could feel an instantaneous release in his muscles, and we'll stretch them out a little bit. And those are some of the main techniques I use. There are literally dozens and dozens of different techniques, but that's how we get the majority of the spine. Now with my patients, I work a lot on flexibility. So someone with a back problem, I'm going to do some stretching. You can see Paul's a little deficient in his hamstring flexibility. We're working on that with him. And the front groin muscle, we try to do some stretching of that, try to get that stretched out, and all kinds of different techniques to help the soft tissues so that they stay where, so the vertebra keep the flexibility and the motion that they give them. So I'm going to have you flip over again. Another way that we help, there are a lot of different techniques. One of my, on your belly? Yeah, thanks. Another one of my favorite techniques is a technique called the Graston technique.
This is a technique that is definitely not exclusive to chiropractic. I learned this. I was sitting in a class with chiropractors, medical doctors, physical therapists, all kinds of different physicians, massage therapists. There's a bunch of different tools in different shapes and different sizes. This bike handlebar one called Graston 1 is one of my favorites for the low back up in here and thigh issues when I'm treating athletes. And I apologize, Paul, that's a little cold. But I'm not digging in here. I'm letting the weight of the tool sort of do the work. And if you look, we've been here 5 seconds. Paul's squirming a little bit because that's cold. But look at that. 5 seconds of a very gentle rub. And look at that blood flow we have going. Okay, this metal has been shown to break up scar tissue. And like if I push my hand here, you can see how tissue moves aside. Well, when I put the bar there, that tissue's got nowhere to run. It can't run away from me, so it really breaks up scar tissue really nice. And look at that redness that he got there. That's great. That redness is blood. And blood carries all the oxygen and the nutrients your body needs to heal. So if you want an area to heal, you need blood flow. And ligaments and tendons and cartilage don't get a lot of blood flow. So a lot of what we're trying to do is enhance that blood flow. As always, and I'll find in future shows, you can sit up, Paul, that we have too little time to go through all the different options we have. But over here, you could just sit out that way. We have 3 different machines that we have that we often use. This is called ultrasound. This is called laser, and that's called muscle stimulation. Actually, can you stand up, Paul? This ultrasound is sound waves, and that's a pretty neat therapy. And what it does is it throws sound waves into the body. And if you look, when I have nothing on, you can see nothing's coming out of there. But when I turn that on, those are sound waves moving the water. And those sound waves, if I am doing a hand, I'll put that in the water. If I'm doing another part of the body, I'll usually put a gel on to transmit those sound waves. And those have a healing effect of breaking up scar tissue and drawing blood flow to an area. The downside of this is it does generate a lot of heat. So in somebody that's real acute, I'll go to this therapy, which is called the cold laser. And that cold laser, well, it's not plugged in. That doesn't help. That cold laser generates a healing effect through cold light. And that does not create any heat. So we find it works real well in acute in situations where there's a heat that generates. The muscle stimulation has a whole boatload of effects and different modalities within it. But this is just a short segment to show you that there are a lot of different options that chiropractors have to help you out. And there's a lot of different tools that when you utilize your chiropractor, you should, if you're not getting better with one method, see if there's other techniques that can be used. But a lot of cool things happen in chiropractic, a lot of real neat healing, and we just love what we do. We're able to affect a lot of different body parts. And if you have questions, feel free to contact me. My information will be on the screen. But we look forward to seeing you in the next show we have. We got a lot of cool shows coming up on a lot of different topics that relate to your health and your wellness. Until next time.